Thank you very much, everybody. Wow. We must be doing something right lately. That's very nice. I appreciate it very much. And welcome to the White House. Great place. No place like it, actually. We're here to announce new groundbreaking actions that we're taking to dramatically increase quality, affordability, and fairness to our healthcare system. This landmark initiative continues our campaign to put American patients first. This is a truly big action. People have no idea how big it is. Some people say bigger than healthcare itself. This is something that's going to be very important. For too long, it's been virtually impossible for Americans to know the real price and quality of healthcare services and the services they receive. As a result, patients face significant obstacles shopping for the best care at the best price, driving up healthcare costs for everyone. With today's historic action, we are fundamentally changing the nature of the healthcare marketplace. This is bigger than anything we've done in this particular realm. And probably, Alex, it's not even close from what they're telling me. We will empower patients with the information they need to search for the lowest cost and the highest quality care. In other words, they'll be able to seek out their doctor, seek out the doctor they want, and they'll be given vast amounts of information about those doctors. And all of our great state legislators, we have a lot of them with us today, a lot of great medical people and doctors. For decades, powerful insurance companies, lobbyists, and special interests have denied the public access to the real cost of the healthcare services they provide. It's that simple. This lack of price transparency has enriched industry giants greatly, costing Americans hundreds of billions of dollars a year. As a result, Americans such as Erica J., who is here today, find themselves in deeply unfair situations. Erica, please, if you would come up and just explain what happened to you. Thank you very much.
Thank you, Mr. President.
Thank you.
Over the last 3.5 years, while fighting a stage 3 cancer, we visited many healthcare facilities. We saw price variations that just caught us off guard, really surprised us, took us by surprise from one facility to the next, and it caused us financial hardship. If price transparency had been required, we would have been empowered to find the best pricing for my care, saving thousands of dollars over the last 3 years. Mr. President?
Yes, I'm ready.
Thank you for this executive order, and thank you for empowering and helping families like mine all over the nation.
Thank you very much. It's very nice. Thanks very much, Erica. A gentleman who's a great gentleman, great economist, Art Laffer. And Art Laffer just got, as you know, Larry just got the Presidential Medal of Freedom a couple of days ago. And Art was telling me that he's the head of a hospital where he comes from. He's on the board. And they did this, he said, it is beyond anything he's seen from an economic standpoint and even a health standpoint. And I said, let's talk about it. And we discussed it. And it's something known very well, but a lot of people don't do it because there won't be some rich people that will be too happy about this. But the people will be happy about it.
Thank you, Mr. President, for taking this action that will put healthcare information in the hands of the American consumer. This truly will be transformational. For years, I've studied the impact of hidden prices and what the impact that's had on markets, healthcare markets, as well as American consumers. My analysis suggests that when cash prices are transparent, upfront in the market, on average, they're 39% cheaper than the amounts that third-party payers pay for like services. Even when insurance covers the cost, there is on average a 300% price variation within a market across for the exact same services. Your healthcare transparency initiative will empower consumers and use free market forces to drive healthcare markets towards lower prices, better outcomes, greater access, and greater value. But this is bigger than healthcare. Lower prices for health care leaves more money in Americans' wallets and in their paychecks for the purchase of all other goods and services that are important parts of their lives. This will be good for America and good for Americans.
You'll get the doctor that you want, and maybe you'll get better than the doctor that you originally thought about. It's pretty incredible. Low-quality care often means unnecessary services. For example, a bad doctor may routinely perform an expensive spinal surgery for back pain without first trying physical therapy. That's why my order directs agencies to help inform the public about the quality of doctors and hospitals by leveraging all of this data. By making much better use of this new information, we will save money and save lives, and your care will be much better. It's incredible. We're also joined today by Dr. Elana George, a longtime advocate for patients. Elana, please come up and tell them a little bit about what transparency means. Thank you.
I love being a doctor. However, one of the most challenging things has been the inability to be an effective advocate for my patients. I have felt powerless at times because of my inability to help them, especially if I have to send them to a hospital and we can't find out the price of the service. Price transparency is the solution to this problem. When patients become healthcare consumers, it will drive prices down, quality up, and most importantly, help doctors serve their patients better. Thank you, President Trump, for this executive order.
Thank you, Elana. Great job. Thank you, Elana. We're making new affordable health options available to millions of American workers through the association health plans, short-term plans, and health reimbursement arrangements. We're working with Congress to stop surprise medical billing. And when you hear surprise, right? Doug. And when we hear surprise medical bill, we're not talking about a positive surprise. We're talking about, not surprise, oh, gee, how happy I am. You're talking about like a disaster. Because no American should be blindsided by bills for medical service they never agreed to in advance. Because people get sick. They don't really think in terms of, let's sit down and negotiate for 20 minutes. You want to get better, and then you get hit, and you get hit really hard. That stops. We're expanding access to tax-free health savings accounts to give critically ill patients access to life-saving cures. We passed Right to Try. We were helped so much by these gentlemen in the front row. What a job you all did, and I really appreciate it. They've been trying to get it for 45 years, and they couldn't do it. And it sounds simple, but it's not, because everybody had a reason for not wanting it. The insurance companies didn't want it because of liabilities. The country didn't want it because they didn't want to be sued. But these are patients that are terminally ill, and they didn't want to give them a potential cure because they didn't want to hurt them, but they're terminally ill. So we agreed that people would sign a waiver. Nobody's going to be held liable. The drug companies, which didn't want it because they didn't want it on their record, we made it a much less part of their record, and we set up different standards where it'd be in other parts, which was great for them. And everybody's happy, and many lives have been saved. I tell you, we had one the other day that was so incredible. So for the first time in a long time, we're doing things that nobody's ever done before from the standpoint of what we're here for. We eliminated the Obamacare individual mandate penalty, which was the most unpopular thing in Obamacare by far. And I had a decision to make. Do we do a good job with Obamacare, the remnant of Obamacare, or do we do a bad job? If I do a bad job, well, then you can blame Obama and the Democrats. If we do a good job, they'll get a little bit more credit, but it's still very faulty. It doesn't work, and it's too expensive. And I told our great secretary, Alex Azar, don't do a good job, do a great job. Do what you have to do, work with the states, do whatever you have to do to make it as good as possible. Once we got rid of the individual mandate, it made it better. But Obamacare doesn't work, but it works at least adequately now. And we're always going to protect patients with pre-existing conditions. People don't understand that we are fighting very, very hard to get it taken care of for pre-existing conditions. And if we weren't, that wouldn't happen. but the Republicans are very much behind that, totally behind that. But we're taking one more giant step toward healthcare system, and a healthcare system that's really fantastic, and it's going to be good, and it's going to work for the people. So I just want to thank everybody for being here. I'm going to go and sign the executive order. And if this is half as big as some people are saying it will be, it'll be one of the biggest things ever done in this world, in this industry, in this profession. And I want to especially thank all of the doctors for being here. We have a lot of doctors in this room, and they're very proud of what they do, and they want to have our system work. And this is something that I think is going to get it to really work efficiently and well. Thank you very much for being here. I'm going to sign the executive order. Thank you.